we've organised this symposium today to look at care services for older people. We know that they face unprecedented challenges. I think we're able to bring quite a unique perspective because we've got lawyers, barristers, academics, journalists and members of the public as well.
There is a fundamental financial crisis that in care of the elderly. But this is not being tackled. The politicians are failing to have the courage to actually put the choices in front of the electorate.
We're launching this report today, and the report is about why we need more social innovation in the care of older people. We're trying to open things up and say, what's the problem in care? Why do we have the kind of care in the forms that exist? And how might we rethink care? So we use the idea of radical social innovation. How do we rethink the basis of care to provide something that's better service both for people being cared for and for the large number of care workers?
What we're hoping to achieve from today is a kind of momentum in thinking about reshaping services for older people.
The thing we're focusing on is the business model, the way in which it's tied up with lots of people travelling around from customer to customer, from client to client, with lots of wasted time, and the scope for more imaginative commissioning by local authorities.
I live in sheltered housing myself, so I know about carers arriving to look after people and also the problems of people having to leave hospital earlier than they should without a real sort of package of care, and the problems that have been raised this morning of the real sort of privatisation of care, the way in which the market is dominating, care is being emptied of its real meaning.
It's become an argument around finance rather than actually a debate about what is it to be human and what are our responsibilities to each other to ensure the adequate provision of good quality care. It's becoming individualised, that it's up to individuals to find care and to meet their care needs.
Local authorities in city regions can make a difference. Major city councils like Sheffield are interested in innovative commissioning and changing the whole model of home care for the elderly.
Conferences like the one that's been put together today are really incredibly important in bringing key thinkers and practitioners, commentators together from a range of perspectives to try and understand how to have a fairer distribution of both the burdens, the costs and the pleasures of later life.